Well, thank you very much, Dave. I appreciate your warm words of introduction. It is a delight to be here on the campus again, and certainly to be here with Martha Anne. It's a delight to see you home. We like that. Chancellor, it's good to see you here as well and to have your leadership in this great state of ours. And I know as much as you're here to celebrate this wonderful accomplishment at OIT, you have to join with me in celebrating the University of Oregon's great accomplishment this weekend, beating Michigan. Proving once again that Appalachia State maybe wasn't that great of a team after all. Senator Whitsitt, other senators, representatives, commissioners, thank you for being here. More of all, thank you for the great lift, the heavy lift, the good work you do in Salem all the time, but especially to help OIT. Thank you for your leadership in the legislature. And I want to thank John Day and Nancy Wendt for their incredible volunteer leadership, their generous contributions, their tireless efforts. On behalf of OIT, but also on behalf of this community, you do so much for so many. We thank you for your efforts. Mayor, it's always good to see you, and it's always good to see Nell Coonan too. Nell, it's good to have you out today. We appreciate all you've done over time. When I look at the assembled dignitaries and community leaders, I can't help but be very impressed with such a powerful team and the collaboration that it represents. And I thank you for what you do here in this community. I'm very honored to be here to celebrate the opening of the Center for Health Professions, and I'm absolutely delighted to see my good friend Martha Anne Dow. She's such a tremendous asset to OIT, the community of Klamath Falls, the university system, and the future of our state. Martha Anne, we have missed you. When I toured this facility in July while it was still under construction, you weren't here physically, but your presence was very much felt. All I can say is that you have imprinted this university and this facility in many wondrous ways. There may be some pretty sophisticated technology that's the brain of this new facility, but Martha Anne, there's no question that you're its heart. We all thank you for your steadfast dedication and the standard of excellence that you have set. And Martha Anne, we also share your fight against cancer. You have hundreds and hundreds of friends and admirers in your corner supporting you during this battle. With your determination and the love that we all have for you, we're going to see you through this fight. You know, there was a time not long ago when people didn't live long enough to become afflicted with some of the diseases, the serious diseases that we face today. I'm a fifth-generation Oregonian, and I think back to when my family got in the wagon, and I don't mean the one with rubber wheels, but the one pulled by oxen or whatever they were. The pioneers' lives were very difficult in the 1840s and 1850s. Their lives were often taken by flu or smallpox, accidental injury, or a struggle with the elements. And I was thinking about that as I prepared these remarks and went back and looked. The life expectancy of somebody in 1850 was a whopping 38 years. 38 years was the life expectancy in 1850 when this state was being begun to be settled. People just didn't live long enough to get the diseases that claim our lives today. Today we live longer and as such encounter a large range of health conditions, diabetes and cancer and Alzheimer's and Parkinson's, and the list goes on. What a transition this state has undergone since the covered wagon days. Once a state of young, vibrant pioneers, Oregon is aging, and estimates indicate that 25% of our state's population will be classified as elderly by 2025. Now that estimate certainly begins to resonate with me, as I'm included in it. And it contributes to Oregon being on its way to becoming, listen to this, the fourth most aged state in the nation. The fourth most aged state in the nation. So the good news is that this is a great facility that we gather to celebrate today that will train the professionals to treat a variety of diseases that will be even more important to all of us gathered here in its celebration. People who graduate here will help keep Oregonians healthy. Just as Intel, Microsoft, and Boeing have lined up to hire young engineers from OIT to put into practice the outstanding education that those young engineers have received in the classrooms here, So too will the health professionals that leave these buildings be sought to go out into the world and expand our understanding of diseases and improve the treatments, care, and compassion that we all will need. Everyone here today knows our state and nation faces a nursing shortage. Unfortunately, the shortage isn't just in the supply of nurses. The healthcare delivery system is desperate for staff with degrees in a variety of health professions, including clinical lab science, medical imaging, respiratory care, and dental hygiene. To hospitals and physician offices, dental practices, and medical labs, I say your call has been heard, and once again, OIT has been there to take it and answer it. As President Dow recently said in her op-ed in the Oregonian newspaper, OIT graduates will be the replacement workforce for the growing tide of retiring professionals, helping to offset the need for new, highly skilled and medical professionals as Oregon's largest population demographic enters its golden years. And as we heard today, that number will be 65,000 additional healthcare workers. Put that in perspective, that's more than the number of people who live in Bend, Oregon today. That's how many people we will need to have trained. The shortage of health professionals our nation faces is in part due to the capacity of the institutions that teach and train future generations of allied health providers. The interest is sparked on the part of students, but the institutions that train them are at a maximum capacity. So interested students end up seeking different career paths as a result. That's why the Center for Health Professions here at OIT is a part of the solution to that capacity problem. When OIT approached me to request, I use the word request, Chancellor. Others might say beg. I say request. With help for the funding, we ran all the traps. And you know, it was an easy sell in many respects because OIT's request immediately stood above others. It was a combination of elements. The CHP will allow the next generation of health professionals to immediately enter medical centers and clinics upon graduation, instantly putting to practice what they've learned here. 600 students per year will receive hands-on training from the high-tech equipment that OIT has requested federal funds to help purchase. That's impact, especially when you consider that 600 students is more than live in many of the towns in our district. That's a lot of people. And finally, the university raised more than $12 million from private sector and local community, secured nearly $20 million in loans and bonds from the state. That's genuine opportunity. It is broad-based support. It wasn't anything the project lacked. Obviously, my colleagues in the House Appropriations Committee saw the qualities in this project that I did, and they recommended $600,000, not everything we asked for. We'll go back and beg again. And now it's up to the Senate as the bill heads over there, and we'll do everything we can to get that funding passed or increased. Meanwhile, I never miss an opportunity to remind my colleagues of the important work that's done here on the campus. While expansion of healthcare training is what we celebrate today, we also should celebrate the other work that's done here, and especially in the notion that this will be the first campus in America that will be totally geothermal powered and heated. And if I have anything to do with it, we're going to direct some federal grants this way to help in that effort. It really is a role model for energy independence. We often hear the term fighting disease, but that's exactly what will be done here. Our bodies generate resistance to combat disease, and our will leads us to persist and not surrender. We call on higher powers, and we rely on those who love us to give us strength. Defeating illness is indeed a fight. And when we're faced with illness, we need a fighting chance, and fighting chances are what this facility really is all about. We will be training the health professionals who will lead Oregonians to healthier lifestyles, and who will be at our side when we are afflicted. Whether teaching us prevention or providing treatments, the people graduating from these buildings will play a major part in shaping the healthy Oregon that we can easily envision. Although the youth of the Oregon Trail pioneers have faded from our sight, the pioneer spirit upon which our state was built is bright as ever and exemplified by the vision of people like Martha Anne Dow. Being an Oregonian is something special. Being a healthy Oregonian is what this new facility is all about. Congratulations on this accomplishment, and best wishes for many successful years and graduates ahead. Thank you very much.